Good afternoon, ladies and gentlemen. This is Woody Collins with Congo Helping Hands, and today is another episode of talking about Congo. So, hope you're doing okay, hope your family is safe and feeling well. So, let's get into the two subjects that we're going to talk about. One is infant mortality, and the other is about the COVID-19 lockdown in Kinshasa, or the Congo, that had a big bearing on what they have achieved so far to date. So let's go ahead and get started. Let me adjust the camera 1 minute a little bit up and we can be ready to go. So I won't be cutting off my head. There we go. Okay, so a little aesthetic better. So one of the things that I read about that was really striking, and the article started out that 5 countries make up 49% of all infant mortality. And infant mortality is generally described as children under the age of 5 that have died. So they come up with these statistics to measure how many kids have died and estimate how many kids have died from the time that they were born to the time they reach 5 years old. And conversely, you have also uh, a maternal mortality. And the maternal mortality is the number of children that died during childbirth itself. So you got both of them. So these are the kids that actually uh, were able to, you know, be the live delivery, and then you track them up to the age of 5. And so this, when they said 5 countries, I go, oh. And the reason I said, oh, because I get the news alert on anything that's dealing with the Congo when it's dealing with a health issue, since that's one of the primary things that we look at in the Congo and try to keep our eyes on. So they named off the number of countries: Nigeria, Pakistan, India, Congo, and Ethiopia. Those were the 5 countries. But then I went on to say that they went on to say that a third of those deaths were just in Nigeria and India. And I thought that was strange. And one of the things that they brought out about the number of deaths, when you talk about sheer number of deaths, India has a much larger population, but when you compare it to Nigeria, Nigeria has the same number of deaths, but they're only 1/7 of the population of India. So that's not bad. You got less population, but you got just as many deaths of children under the age of 5. So I remember early on when we started working in the Congo, that was one of the things that we wanted to impact in this small village. Is that we wanted women to come in for their prenatal exams, and also we wanted them to protect themselves against malaria. Malaria is a big killer among pregnant women and also their children. Uh, their their uh, their systems are not developed enough. The immunization, they don't have all the things that's going for them, so they can die a lot easier when they in such a young state. So we did different baby packs, which we gave them out as a incentive to come to the uh, prenatal exams, and then we also gave them a mosquito net. And so I was just wondering how other areas of Congo was doing. And so Congo is not doing too terribly bad. Right now, it's about 11% of the children went from 11% in 1990 to about 7% now. So they have reduced the number, the percentage of infant mortality, but the numbers have went up because they have an increase in population now. That the numbers are still, they have actually more deaths, but that's due to a larger population. So that's kind of that I found out. It's kind of to me, it's good in one way, and another way, it's not as good. The second thing that I want to talk about today is the COVID-19 lockdown. I've been really looking at the COVID-19 lockdown, and then also what prompted me to say, "Ooh, this thing is real," is the president of the Congo, Felix Tshisekedi. He sent in uh, by tape, by video, thanking the UN for what they had done for Congo because they had effectively taken good actions to reduce the number of deaths due to COVID-19. Right now, they only have 271 deaths and 10,500 and some uh, cases. And what they were attributing that to is the lockdown. And how the lockdown worked was when they started seeing the deaths in Europe going down, they started making plans. And as soon as someone traveled from Europe and brought the disease to Congo, and it started, increasing, they started getting deaths. They immediately put a lockdown. They stopped all flights within the country and also flights into the country. So that was around the 16th of March, and I was scheduled to go over there in March, and so they canceled. I had to cancel my trip because there was no way, and I couldn't get in the country. So that's what they effectively did, was lock down the country, and then they also locked down the place where the majority of the cases was coming from. It's happened to be uh, a area of town where most of the businesses are located at downtown, and that's the area they locked down. It's called Gombe, the Gombe quarters, and they locked down that nobody could enter into there unless you had a special pass, uh, and none of the people out of Gombe could travel back at home. Travel outside of that area because they knew that the majority of cases were coming from businessmen and women traveling back and forth into the business district. So that's how they effectively closed down, and that stayed locked down for at least a couple months. I think it was in July or sometime, and maybe even longer than that, that area of the country was actually locked down. So can you imagine if we had even locked down some cities that had the COVID pandemic? We are doing it by county, where we are limiting the number of things you can do and gathering size based on what county you live in. But they have actually did it within the city because they have one big city, and they stopped all traffic going into the country by road and by river, and also coming out of Kinshasa. So they basically locked down, and they did not start open that back up until things were well under control. So that's why you see that it's only 271 deaths that they've had so far to date. And that was what the president has said. And then I heard that also from another source that said that they attribute that lockdown to effectively controlling the COVID-19 pandemic. And also, one of the things that also has come up is that Congo's age, the number of people that's under the age of 25 is relatively high. And so those are the people who could be asymptomatic and walk around and not be affected by the COVID. And the majority of the deaths that they had was just like ours, people that's over 65 and things like that. So that was I was just interesting to see that the president actually was relaying back to the uh, the UN headquarters and via a video telling them how well they had done. So I thank everybody for tuning in, and I hope that was interesting to you as it was interesting to me, but probably not as interesting because I like to do stuff like that is to determine the why. Tomorrow we'll have a couple other things that we'll be talking about. And in the meantime, I would like for you to be safe, take care of your family, and take care of yourself, and be blessed. And we'll see you tomorrow. And also, if you have any questions that you may have, please send those in so that we can get your question answered. Because I know people have questions that don't make sense to them, or is curious about that maybe I can answer, or at least get the answer to those. So I ask you now to we'll see you tomorrow.